Well, we've heard a lot about the bill. It's a large bill. It has many provisions in it. I'd just like to take a little bit of time and talk about a specific area of the bill, and that's patients who are dependent on insulin. As Senator Benson mentioned, there are some provisions in the bill that I worked on and that she worked on, and I'd like to acknowledge that, certainly the emergency prescription refill language is going to be helpful to some patients who have the means to pay for a prescription refill and be able to obtain it when they need it in an emergency situation. The information provisions that will allow pharmacists to have access to information that they can provide to insulin-dependent patients. That's another area where we could also be helping people who need insulin access. And as she mentioned, the cost-sharing language that I know she worked very hard on to specifically apply to insulin prescriptions. And we will have to see, will that be a way that patients who have insurance will see some relief. I guess the level of relief and what the net price will be passed on to them at the pharmacy. I hope that is a significant or has a significant role in making insulin more affordable. But I have to question, why are we're still missing a segment of the population, and we have the ability to make something happen this year in Minnesota to help patients who feel that they're in an emergency situation. They either are, for some reason, have become uninsured. They are patients who have a high deductible plan and they're paying $5,000, $6,000, $7,000 out of pocket before they get to reach their deductible level, and they simply can't afford insulin that they need to live. And we've heard through the session about people who are experiencing crisis situations. Certainly my constituent's family, whose son, Alec, he was in a situation where he aged off his parents' plan. He didn't feel or wasn't able to find a plan that was affordable to him at his very modest income of about $35,000 a year. And so he went uninsured and as he was uninsured, he went to the pharmacy, and what he was facing was list price for insulin, $1,300 for 1 month's supply. And I think all of us, I think if we were facing a situation like that, it would really be extremely stressful, and I don't know that many of us would find a good, reasonable course of action in those situations. And we might do what, unfortunately, many diabetics are doing, and that's trying to make their insulin last longer by rationing. And it's dangerous. In Alec's case, it led to his death. He was rationing, and his body, it shut down. And so now we're left to ponder, what could we do? What can we do to assist people who are in this situation? They don't have the money to be able to afford their next month or two's supply of insulin. And we discussed, and actually was brought forward by Senator Benson when we had the HHS bill on the floor. One possible solution that we could put forward in Minnesota this year to address this. While her amendment didn't note it, the House passed the bill, and that was called the Alex Smith Emergency Insulin Act. And it's one way that we can say, we're not going to simply sit back and wait for insulin manufacturers to adequately address this situation. And it's a way that we can ask some small thing from the manufacturers to help us assist with this program. And so, Mr. President, I'd like to offer the A1 amendment. Thank you, Mr. President. The A1 amendment is the Alec-Smith Emergency Insulin Act. It provides for an insulin assistance program that is paid for by collecting a fee from manufacturers. There's an insulin registration fee that will be assessed, and this fee will be collected until we reach a cap. We've put in a cap in this particular amendment of $5 million over a course of a year that would be collected from manufacturers. And then that fee would go towards a program where a patient who is uninsured, who is insured but has no pharmacy coverage, or who is insured but has a high deductible plan that requires them to pay out of pocket at least $5,000 or more. And all of the people who would qualify for this program must have a family income that's equal to or less than 400% of the federal poverty guidelines. So it's meant to cover people who are most in need at the time they most need access to an insulin supply. The patient could apply for the program. They would receive a card, and that card would be valid for 90 days. So basically, if they needed to get a prescription refilled, it would be up to 3 times. It would allow them to assess other options. How can they find health insurance coverage that is affordable to them, and then be able to move on with their lives in a way that that they can get along and get onto a coverage mechanism that actually is affordable to them. It sets up an insulin assistance account for the funds to go into and out of. There is not a net cost to the state. The amount collected would be dispersed to cover the program. And I hope, we considered a very similar proposal from Senator Benson a few weeks ago. This proposal it had slightly different coverage. It was not covering underinsured patients. It was strictly uninsured, and had a 30-day window instead of the 90 days. But really, when I've discussed this with others in our chamber and in the House, we really feel that the amendment, as this amendment is put together, would have practical benefit, and it's something that we could do now. And I don't think that patients have been experiencing price increases over the last 5 to 10 years, where their insulin has doubled and tripled in price. And I think that the time is now for us to be addressing all aspects of this. Yes, we need to look at transparency, and we need to look at the role of PBMs when we're doing those things. But we need to address patient needs, patients who are rationing and running into emergency situations right now. So I really hope that today we can also support this amendment going forward. We've had a lot of discussion about it over the past couple of weeks and conversation about how we can move this forward, and I hope that we can put this amendment on and move this forward on the omnibus bill tonight. Thank you, Mr. President. I just wanted to respond to Senator Jensen's remarks. As Senator Little pointed out, the emergency refill only helps for people who are able to pay for that refill. It will give them the opportunity to receive it, but they have to pay for it. Second, as far as working with doctors, I'm all for that. I spoke with an endocrinologist, I won't even try to say, a doctor who treats diabetic patients. Early in session, he acknowledged that, yes, doctors need to do a better job of talking with their patients about, are you having issues with cost? How can we help make sure that you're able to stay adherent to your, what you need from your insulin? And yes, we need to make sure that happens. But he also said that there are cases where people need access and they need it for a short period of time. This 90-day window isn't meant to, defer or deter someone from going to their physician. They need to go to physicians. It's meant to get them through a situation where they are experiencing financial hardship and they can't afford their insulin. They would also be able to receive the information about other options, other public programs at the time they're able to do it. So I think those aren't helpful in moving this particular argument forward. Thank you. Thank you, Mr. President. I know we've had a lot of discussion, and I will try to be brief, but I really have to respond. After we had a chance to hear this amendment when it was brought to the floor by Senator Benson, and we had a chance to vote on it, and we voted 65-0 to move this amendment forward in the HHS bill. I really took that as a sign of support. And things I care about, I really do like to work on them to the full extent during a session. And so I followed this provision during the conference committee. And I know I sat in the audience one day, it was discussed. Representative Howard and I sat and listened. It was discussed. And there was specific discussion about how it was going to be taken offline, not as a part of the committee meeting, but it would be discussed behind the scenes, and there would be further development of the language. I continued to work with the House conferees, with the Senate conferees, providing language, providing information. There was ample opportunity for the committee members to understand the amendment better and to get more information if they need it. The Board of Pharmacy has been very involved. DHS has been very involved in development of this language. I wouldn't keep moving it forward if I thought it wasn't going to work. And I really, I think we're here today. We have another opportunity to say it's important and we can move it forward in this bill. I urge you to vote yes.